So all the premiers were called up to Ottawa. They were told by Justin Trudeau how many billions he's going to give them for health care. Does that fix it? Dr. Shawn Whatley is author of When Politics Comes Before Patients. He's a medical doctor, former president of the Ontario Medical Association. He joins me now. But the question to you, all those billions, are we all going to get better health care?
No, but money always helps some of the problems that we're struggling with. So money's not the solution. Doesn't hurt. That's what I'm trying to say.
So what needs to be done?
Well, three things, and this oversimplifies a complex problem, but I think we need to do three things. Look at governance, who's in charge, emphasize the basics, life and limb care, and then have a hard discussion about what's appropriate. So some of the things that are probably considered luxuries, we can circle back and unpack what that means. So who's in charge means, should you blame the federal government or the provincial government or your local hospital or your local doctor when you can't get care? We need to figure out who's in charge.
Well, I mean, who is supposed to be in charge of that? I mean, all four of them aren't in charge of it.
Well, it depends.
If you're in a town in Ontario, and BC, you haven't got a doctor, what does that mean? Doesn't that mean the provincial government should say, we're going to get more doctors?
Well, the Constitution Act says yes, it's the province, but the feds use their federal spending power to bribe the provinces to do things that the provinces would never have done otherwise. So the feds end up calling the shot for 20 cents on the dollar.
That sounds like Soviet Union of years ago. They're in Moscow and they're deciding what's going to go on all over the place. I mean, is that useless?
Well, those are your words. Those are your words. I call it central planning. Central planning always fails. We can do better, but the first job is find out who's in charge, and the second job is to emphasize the basics, life and limb care. That's what the public expects.
Okay, so who's in charge? You just said it yourself. The Constitution, the provinces are in charge. So the provinces are the ones that are getting the grief for not having good health care. And so they've got some money. Can they not just sort of grab the bull by the horns and say, okay, we're going to have more medical schools, we're going to have some paramedics, we're going to change the way medicine is practiced?
So that's what they've been doing. They try to talk about resources, inputs, right? We need to focus on outputs. Inputs aren't enough, and we also need to separate politics from management. Right now, the managers at the hospital level or any level worry about what the politicians think. The politicians are always stressed about what the management decides. Until we separate those two bodies, we won't get good care for patients.
So whose responsibility is it? Is it the provincial ministers of health who should just sort of get together and say, here's my idea, and say, let's just put this in scheme?
We need a multilateral process. The feds, the provinces, the locals, and they need to get together, including unions and medical associations, and agree, what is it that we want to achieve? Do we want care, or do we want to just redistribute money? Roy Romano calls Medicare our great redistributive program. Is that why Medicare exists, or does Medicare exist for patients?
Question for another day. Shawn Whatley, thank you very much. 3 minutes. Thank you for contributing. We are almost out of the hole. People like the show, and we want to keep it on the air. So, press subscribe. Press PayPal. PayPal is really simply a credit card that you can pay with. And if you're writing a check or a letter, please put your address in, because I will send a letter to everybody who contributes money. Subscribe, PayPal. Thank you.